Have you ever looked in the mirror and felt something was off, but you couldn't quite explain it? Maybe your face seemed a little more tired than usual. Maybe climbing the stairs left you more winded than it used to. These changes often whisper before they scream, and one of the most common silent culprits behind them is iron deficiency. Iron deficiency is not just about feeling a little tired. For many people, it is the early signal of something deeper happening in the body. I have spent decades seeing patients walk into my office complaining of vague symptoms, fatigue, poor concentration, or even unusual cravings, only to discover that their bodies were quietly begging for more iron. Left unchecked, this deficiency can pave the way for serious consequences, from chronic anemia to even uncovering hidden conditions like colon cancer. One of the earliest and most visible signs of iron deficiency is pale skin. Not the kind of paleness you get after a long winter indoors, but a change in your skin tone that almost seems to drain the life out of your face. Your body relies on red blood cells to carry oxygen, and those red blood cells get their rich color from a protein called hemoglobin. Hemoglobin, in turn, depends on iron. When iron levels fall, so does hemoglobin, and without it, your blood loses its deep red hue. This doesn't just change your skin, it changes how your entire body functions. You can often see this in your inner eyelids. That small pocket under your lower lid should be a healthy pink, full of tiny visible blood vessels. But if it appears pale or washed out, that is your body sending you a subtle alert. I always encourage people to take a moment in the mirror, pull down that lower eyelid, and really look. It is one of the simplest and most reliable ways to catch low iron early, no matter your skin color. Your palms can also reveal the truth. Those lines that run across your hands, they should be darker than the rest of your palm. When iron drops, those creases fade, and your hands may look unusually uniform or pale. Again, this isn't a cosmetic issue. It is about what is happening inside your blood vessels and cells. But the deeper concern goes beyond appearance. When you do not have enough iron, your blood simply cannot carry enough oxygen. That means your heart and lungs have to work harder to push the same amount of oxygen through your body. That is why you might feel short of breath, even when doing something simple like walking through the grocery store or carrying a bag of laundry. You are not just getting older or out of shape. Your body might be fighting a battle you cannot see yet, and that is the power of understanding these early signs. They are not there to scare you. They are there to guide you, to help you catch what matters before it grows into something more dangerous. To listen when your body whispers, so it never has to scream. There's a certain kind of fatigue that doesn't go away with rest. It creeps into your mornings, it lingers through the afternoons, and it makes you question whether something deeper is going wrong. That kind of exhaustion often comes with other strange little signals your body sends when it's low on iron. Take a moment to look at your fingernails. Not just the color or cleanliness, but the actual shape. Healthy nails tend to have a gentle, natural curve. But if your iron levels have been running low for a while, you might notice your nails becoming thinner, more brittle, and in some cases, starting to curve inward like the bowl of a spoon. This condition, known as spoon nails, isn't just about aesthetics. It's your body's way of telling you it's struggling to carry oxygen to your cells, and your extremities are feeling the strain. I remember seeing a young woman who came in for fatigue and low mood. She had tried vitamins, adjusted her sleep, even cut back her work hours, but nothing worked. What caught my attention were her nails. They had a noticeable dip in the center, almost like they were scooping inward. A quick blood test revealed severe iron deficiency. Within weeks of proper treatment, not only did her energy improve, but those spoon-like curves began to fade. It's incredible what a little more oxygen, delivered by iron-rich blood, can do for the human body. But it's not just what you see, it's also what you crave. One of the most bizarre and fascinating signs of iron deficiency is called pica. It's when people develop an urge to eat things that are not typically considered food. The most common of these is ice. That's right, if you find yourself constantly chewing on ice cubes, going out of your way to refill your glass just to crunch on frozen water, your body might be begging for iron. This isn't just a quirky habit. In clinical practice, I've seen this enough times to take it seriously. Ice craving is so closely tied to iron deficiency that when I see it, I immediately run lab tests. Some patients have even reported cravings for chalk, raw rice, cornstarch, or even dirt. The brain, when deprived of certain nutrients, starts sending unusual signals. In the case of iron, these cravings are like a built-in radar for deficiency. And then there's your tongue. Another place iron deficiency can quietly reveal itself. A healthy tongue has tiny bumps called papillae that help with texture and taste. But when your body is short on iron, those bumps start to disappear. The result is a smooth, shiny, sometimes reddish tongue that feels strange in your mouth. People often describe a burning sensation or a change in how food tastes. These may sound minor, but they are critical signs that your body is having trouble maintaining normal function. The tongue, like your nails, is made up of fast regenerating cells. It constantly renews itself, which means it needs a steady supply of oxygen and nutrients. When iron is low, it's one of the first places to show signs. The disappearance of texture on your tongue is your body waving a red flag, hoping someone is paying attention. These are the moments where listening matters. These signs, spoon nails, ice cravings, a burning tongue, are not random. They are your body's attempt to communicate with you in the only way it knows how. And when we take the time to notice, to ask why, to test and treat early, we give ourselves the gift of better health before the problem becomes dangerous. Iron is not just a number on a lab test. It is a lifeline your body depends on every single day. Without it, the systems that keep you moving, thinking, and feeling alive start to fray at the edges. And if your body is sending you messages, it's time to listen. Sometimes, it's the subtle changes that catch us off guard. A small crack at the corner of your mouth, a strange tint in your urine. These are not the kind of symptoms that scream for attention, but they whisper a truth that should not be ignored. When your body is running low on iron, it begins to show signs in places you might not expect, and some of them are surprisingly easy to miss. Let's talk about those cracks in the corners of your mouth. If you've ever felt soreness there, or noticed red, irritated splits that don't seem to heal, you might have experienced angular cheilitis. It sounds like a complex medical term, but all it really means is inflammation and breakdown at the delicate place where your lips meet your face. This area has to be strong, stretchy, and moist all at once. When your body has enough iron, it can maintain that tissue. But when iron is lacking, healing slows down, and something as simple as speaking or eating can cause the skin to crack. This may sound like a small inconvenience, but in my years working with patients, it has often been one of the earliest red flags that something is wrong. People try lip balm, creams, even antibiotics, but the cracks keep coming back. When we check their iron levels, the story starts to make sense. It's not just about dry skin. It's about a body that is struggling to maintain its own barriers. And then there's your urine. Yes, your urine can tell you a lot more about your health than most people realize. For example, have you ever noticed your urine turning pink or reddish after eating beets? That might seem like a harmless coincidence, and for many healthy people, it is. But for others, it's a sign that their body is struggling to process certain natural pigments because of low iron. This condition, called baturia, happens when your body fails to break down a pigment in beets known as betanin. Normally, with enough iron, your system handles this easily. But without it, more pigment passes unchanged into your urine, giving it that reddish hue. Only about 1 in 10 healthy people experiences baturia. But in people with iron deficiency, the number can be as high as 8 out of 10. That's a big difference, and one that tells a deeper story. These might seem like curious facts, but they speak to a larger reality. Your body relies on iron not just for energy, but for every layer of repair and protection. One of the most important roles iron plays is in your immune system. Without enough iron, your white blood cells, the foot soldiers of your body's defense, lose their strength. They can't produce enough of the molecules that kill bacteria and fungi. That's why iron deficiency doesn't just make you feel tired. It makes you vulnerable. Fungal infections, like ringworm or athlete's foot, often start to appear more frequently in people who are iron deficient. The fungi sneak in through tiny cracks in the skin, and without the immune system firing on all cylinders, they spread. It's not just about hygiene or exposure. It's about your body losing its ability to fight back. I once treated a man in his 60s who kept getting a recurring rash on his arm. He had tried every cream on the market. Nothing worked. After running tests, we discovered his iron stores were nearly empty. Once we corrected the deficiency, the rash faded for good. That's the power of addressing the root cause, not just the surface symptoms. Low iron can also make you more susceptible to bacterial infections, especially on the skin and in the lungs. Your immune system is like an army. Without enough iron, it's trying to fight without weapons. It's one of the many reasons why catching iron deficiency early can change the trajectory of your health. So if you find yourself dealing with stubborn mouth sores, strange changes in your urine, or recurring infections that just don't make sense, take a step back, ask why, listen to the signs. Your body is always trying to communicate. And in these small, persistent clues, it may be telling you something important. When people think about iron, they often imagine blood. They think of energy, maybe muscle strength, but what they rarely consider is how deeply this one mineral affects the mind. Iron is not just about oxygen delivery. It is about brain chemistry, sleep quality, emotional balance, and neurological function. And when your body falls short on iron, the first place to suffer might be your peace of mind. One of the most distressing symptoms of iron deficiency, and one that often goes unrecognized, is restless leg syndrome. Picture this. You are lying in bed, exhausted, ready to sleep, but your legs seem to have a mind of their own. There is an urge, an itch, a need to move them, even though you are trying to be still. This sensation can make rest feel impossible. Night after night, people lie awake, wondering if they are losing control of their nerves. The surprising truth is that restless leg syndrome is frequently tied to low iron levels, even when those levels appear normal on a standard blood test. You see, iron is regulated differently in the brain compared to the rest of the body. You can have enough iron in your bloodstream, but still be short where it matters most in the brain tissue responsible for managing movement and calming the nervous system. In my clinical work, I have seen patients with low normal ferritin levels suffer for years before anyone considered checking for iron-related causes. Once they began iron supplementation, some of them saw their symptoms fade within weeks. That is the mystery and magic of iron. It hides in plain sight, and when restored, it can bring back the stillness and calm your body craves. But restless legs are only one part of the story. Iron is deeply involved in the production of two critical brain chemicals, dopamine and serotonin. These are not just buzzwords in psychology. They are the very messengers that help regulate your mood, focus, motivation, and emotional stability. Without enough iron, your brain cannot make them in the right amounts. The result? You feel unmotivated. You feel down. You lose interest in the things that used to bring you joy. I always include iron deficiency in my mental health evaluations, especially for patients struggling with depression or anxiety that doesn't respond well to usual treatments. In many cases, it is not just psychological. It is physiological. It is chemical. It is treatable. And there is more. In rare cases, iron deficiency can even increase your risk of stroke. That sounds extreme, but it's real. When your body is low on red blood cells, it sometimes tries to compensate by increasing the number of platelets, the tiny cells responsible for blood clotting. This condition, known as thrombocytosis, makes your blood more prone to forming clots. And those clots, if they travel to the brain, can cause a stroke. There have been cases of young, otherwise healthy women having unexplained strokes, the only common factor being dangerously low iron and high platelet counts. These are not just coincidences. They are red flags. Loud and clear. Even if you never experience something as serious as a stroke, the neurological symptoms of iron deficiency can quietly erode your quality of life. Brain fog, difficulty concentrating, emotional swings, and insomnia are all linked to low iron. These symptoms are often brushed off as stress, aging, or hormonal changes, especially in women. But they deserve more attention because the solution might be simpler than expected. I recall one patient, a retired teacher in her early 70s, who told me she was starting to forget names, misplace items, and lose focus during conversations. She feared it was early dementia, but when we checked her iron levels, they were barely supporting her body's basic needs. Within 3 months of iron therapy, her clarity returned. Her confidence came back. She didn't have a memory problem, she had a nutrient gap. This is why iron matters. It is not just about red blood cells or avoiding fatigue. It is about the way you move, the way you feel, the way you think. If you are struggling with sleep, mood, or memory, and nothing seems to help, consider looking at your iron. Sometimes the brain isn't broken, it's just running on empty. When someone walks into my office with fatigue, brittle nails, or brain fog, one of the first tests I order is a ferritin level. Ferritin is a marker of how much iron your body has in reserve. Think of it as your personal iron savings account. When it runs low, your body starts dipping into emergency mode, pulling iron from wherever it can to keep basic functions alive. That's why ferritin is such a reliable early clue, often dropping before any other blood markers begin to look suspicious. But here's the tricky part. Ferritin can be misleading if there's inflammation in the body. When you have an infection, an autoimmune condition, or even certain cancers, ferritin can appear normal or elevated, even when your iron stores are dangerously low. That's why we also use a full iron panel, which looks at things like serum iron, transferrin saturation, and total iron binding capacity. Together, these tests paint a more complete picture of how well your body is managing iron. Once iron deficiency is confirmed, the next question is critical. Why? Where is the iron going? Or why isn't it getting in? There are 3 main pathways to consider: increased demand, decreased absorption, and chronic blood loss. Increased demand happens most commonly during pregnancy or in periods of rapid growth. The body needs more iron to support expanding tissues and blood volume. That's why so many pregnant women are prescribed iron supplements. Their bodies are building something extraordinary and burning through iron faster than normal. Decreased absorption is trickier. Even if you're eating enough iron, your gut might not be allowing it in. Conditions like celiac disease, Crohn's disease, or a history of gastric bypass surgery can severely limit how much iron your body absorbs. I've had patients who eat well, take supplements, and still remain anemic because the problem isn't in their diet, it's in their gut lining. Then there's chronic blood loss. For some, the cause is obvious heavy menstrual bleeding, recent surgery, or gastrointestinal bleeding. But the most concerning cases are the silent ones. I've diagnosed more than a few cases of colon cancer in patients whose only symptom was persistent iron deficiency. No pain, no visible bleeding, just slowly draining iron stores over time. That's why I take iron deficiency seriously, especially in men or postmenopausal women, where blood loss should be rare. The good news is that treatment is often straightforward. Oral iron supplements can help many people rebuild their stores within weeks or months. For those who cannot tolerate pills or who have absorption issues, intravenous iron is a powerful alternative. It delivers what the body needs directly into the bloodstream, bypassing the gut entirely. But beyond treatment, prevention and absorption are key. One of the easiest ways to boost iron absorption is to pair your iron-rich foods with vitamin C. A glass of orange juice, some strawberries, or even tomatoes can significantly increase how much iron your body absorbs from that meal. On the flip side, calcium, coffee, and tea can block iron uptake. That's why I often tell my patients, don't drink your morning coffee with your iron pill. Give it a couple of hours. Let your body make the most of every milligram. And here's a tip I love sharing: cook with cast iron pans. It's simple, old-fashioned, and incredibly effective. When you cook acidic foods like tomato sauce in a cast iron skillet, tiny amounts of iron leach into the food, giving you a nutritional bonus with every bite. Over time, that can add up and help maintain your levels naturally. In the end, iron deficiency is not just a medical issue. It's a conversation between your body and your awareness. Your body has been whispering to you all along through your skin, your nails, your mood, your sleep. It's not trying to scare you. It's trying to guide you back to balance. If you've seen yourself in any of the signs we've discussed, don't wait. Talk to your doctor. Get tested. Nourish your body with what it needs. Because strength doesn't just come from muscle or willpower. Sometimes it comes from a little mineral your cells have been longing for all along. Stay curious, stay kind to your body, and never stop listening.